My name is Christopher Morphew, and I'm Dean of the Johns Hopkins School of Education. I want to welcome you to the second of a series of webinars that we've put together. We're calling this series Impossible or Imperative. Our topic for today is Who is Left Behind? Equity and the Push to Reopen Schools. Last week, during our first webinar, we explored the politics of reopening schools and made clear that this issue has become highly partisan. At the same time, there's been little focus on the students at the center of this incredibly complex exercise. As we push forward on this to understand this contentious issue, this session examines who is being left behind. To what extent has equity been a consideration in the push to reopen schools? Is our approach to COVID-19 actually contributing to greater gaps in access, learning, and safety for at-risk groups? While the nation has been focused on the issue of reopening schools, it isn't always clear that that attention includes a perspective that considers how reopening or not reopening schools during a pandemic may harm some students disproportionately. And yet, I think this pandemic has taught us all and reminded others of us of the vital role that schools play in students' lives and in their communities. Schools are hubs of learning, yes, but they're also hubs for nutrition, for safety, and healthcare. And any decision that results in less access to these services must be considered very carefully. So today, to discuss this, we have invited some of the nation's top education, ethics, and technology experts to discuss who is being left behind. What does reopening or not reopening schools mean for underrepresented students? What are the ethical issues that we should be considering during this debate? And how can technology contribute to equitable solutions to operating schools virtually or otherwise during this pandemic? So first, let me introduce our panelists. Dr. Megan Collins is an assistant professor of ophthalmology at the Wilmer Eye Institute and an associate faculty member at Johns Hopkins Berman Institute of Bioethics. Megan is also co-director of the Johns Hopkins Consortium for School-Based Health Solutions, and she is one of 3 primary investigators working on the Johns Hopkins eSchool Plus initiative, a collaboration between the Schools of Education and Medicine and Berman. Thank you for being here, Megan. Next, Cheryl Holcomb-McCoy is a friend of the School of Education here at Hopkins and currently the Dean of American University's School of Education. Cheryl has been Dean at American since 2016, and prior to this time, she served as the Vice Provost for Faculty Affairs at Johns Hopkins and as Vice Dean in the School of Education here at Hopkins. Trained as a counselor educator, Cheryl is an expert in multicultural research, college advising, and served as a consultant to the Obama administration's Reach Higher initiative. Cheryl is a fellow of the American Counseling Association. Thank you for being here, Cheryl. And finally, especially relevant to a discussion that will inevitably include a focus on technology, Joseph South, Chief Learning Officer of the International Society for Technology in Education, or ISTE. Joseph is one of the most respected experts on educational technology in the United States and formerly served as Director of the Office of Educational Technology in the United States Department of Education. He has led learning product development teams at startups, museums, nonprofits, and higher education institutions, and consulted on projects around the world. Thank you for joining us, Joseph. Thank you all for being here. And now to our audience, you out there, we've got a few guidelines about our discussion this afternoon. I'm going to start by asking each of our panelists one question to get things started. Then I'll be directing a series of prepared and reactive questions to the entire group. But we want you to join in too, and you can submit questions by pressing the Q&A button at the bottom of your screen. As soon as those questions start coming in, we will get to them as quickly as we can, and we'll attempt to start with questions about halfway through the discussion and get to as many as we can. So again, welcome to all of you, and let's get started. So Megan, I'll begin with you. As I mentioned in your introduction, you're a medical doctor and someone who's been involved with the Berman Institute. And I'd like to start with a question about ethics. What are the primary ethical variables that a decision to reopen schools should be considering?
First of all, thank you, Chris, for being here today. I'm here in lieu of one of my wonderful colleagues and collaborators, Ruth Faden. Are we going to get slides up now? If I could have the first slide. Chris, as you so nicely outlined, as we are having this national discussion about reopening schools, it's essential for there to be a lens on equity. And we're discussing when to reopen schools, how to reopen schools, and there really needs to be recognition that students from disadvantaged backgrounds are the ones that have lost out the most. The quote at the top here is from a recent report out of McKinsey and Company, "The Hurt Could Last a Lifetime." And this really is a recognition that there is a potential implication for a generational impact on K through 12 students across the United States. Now, the reality is we all are becoming even more aware that there were massive underlying inequities going on across the United States before COVID started, and they were impacting child well-being. And schools have become an institution that we have relied upon to help mitigate some of these structural injustices. And I'll talk a little bit about sort of how schools are doing that on the next slide, but all of this has been exacerbated by COVID. Not only are the underlying inequities worsened, but new inequities have come up because of COVID and because of lack of access to school resources, really resulting in this sort of compounding impact with egregious injustices that are really ethically intolerable. Going on to the next slide, please. It's really important for us to recognize schools are an institution of education, but they also have evolved over time as being a source of a number of other resources for children. They are a place where children get a lot of healthcare, either through school-based health centers or through school-based delivery of things like vision care or dental care. They are a source of mental health services as well as social and emotional development. They're a place of safety. We know that school teachers are one of the primary sources of reports of child abuse. They're also a place of security, particularly for children who may be living in unstable housing, may be homeless, and this is a place that they have safety during the day. And finally, they're a place where millions of children across the United States get food on a daily basis. So when schools abruptly closed last March, and as schools did their best to attempt to shift to a virtual reality, they were struggling not only to how do they instruct students, but how do we continue to provide all these other resources that they had been providing, again, with a recognition that students who needed them the most were the ones who were having the most risk of not accessing them. Go ahead to the next slide, please. Now, we've had a lot of discussion about there are inequities, and one of our areas of attention with the eSchool Plus initiative, which I co-lead along with School of Education expert Annette Anderson and Ruth Faden from the Berman Institute, the eSchool Plus initiative is specifically focused on equity and school responses to COVID-19 for K through 12 students, with the recognition as states and now as districts and schools are developing their reopening plans. We think it's imperative for them to have an eye towards equity. So part of this work is to do issue spotting, but then the next step is for us as schools, as society, to give schools the resources that they need to help try to narrow these broadening equity gaps. Thanks, Chris.
Thanks, Megan. So next, question for Cheryl. Cheryl, I mentioned in your introduction your background as a counselor educator, and I'd be interested in your thoughts on who do you think is being left behind as decisions are being made about reopening schools?
Thank you, Dean Morphew and Dr. Anderson, for the invitation to participate today. It's wonderful to be back with JHU friends. My first reaction to the webinar title, Who's Left Behind, and to your question, somewhat perplexed me a bit, because one could interpret it as meaning that COVID is causing some students to be newly left behind or going to a remote kind of status, meaning that there will be new kids left behind or new students left behind. But we've known, as the previous presenter said, we've had education disparities for hundreds of years. And so in terms of equity, and you can put the first slide, please. In terms of equity, students of color, Black, Latinx, Indigenous populations, Black students, brown students, have experienced inequitable opportunities in education for hundreds of years. And, this morning, I can't help but to mention, because I think it's very relevant for this conversation about who's left behind, I also want to acknowledge the recent shooting of Jacob Blake in Wisconsin, as well as the killings of Breonna Taylor and George Floyd and countless others. These cases of killing young Black men and the traumatization of children by the very people who are there to protect them is daunting. So I would even add to this list that traumatized Black and brown children are surely left behind, and Black men are surely left behind due to the threat of police violence. So my question, I guess, to this conversation today is more about how do we ensure that we don't replicate the systems and the policies that create inequities in the first place? I think that is probably, because we know who's left behind. The question is, how do we not replicate those same inequities? My views are really centered from an anti-racist perspective, are centered on the racialized policies that create gaps in opportunity and achievement across groups. And this was even pre-COVID and now during this COVID era. And I believe taking an anti-racist approach in this conversation is the only way to go, especially as we talk about, rectifying or resolving equity issues. Some people are somewhat nervous, and I've even had some resistance to discussing anti-racism, although there has been a surge in readings recently about anti-racism in education. But the focus of anti-racism is on actively pushing back and disrupting those policies that further exacerbate racist ideas. Ideas such as certain students who are underachievers, those students that are thought of as not being as smart, lacking in some way, so a deficit approach. And these ideas result in racialized policies such as discipline policies, special education policies, attendance policies, identification for the gifted and talented programs, policies even about teacher education and credentialing of teachers and professional development during this period take on some of what I call these racialized policies. And so I think as we think about equity, I think it's important that we look at those policies very, very carefully and to disrupt those policies that really work against our equity efforts. So this is sort of a quick checklist I was thinking about for this conversation. What would I tell a leader, a school leader or an educator about reopening schools now, whether it be face-to-face and some blended or remote setting? I think in order to ensure equity for all students, we must first check those policies that have created uneven racialized outcomes. So we have discipline policies that surely are created, that are punitive in nature, that often disproportionately affect young Black and brown students. Grading policies and academic feedback. If we're going remotely, are we flexible enough in the grading to ensure that students have the opportunity to turn in assignments? Surely we have to look at the access to computers and Wi-Fi and those kinds of mechanical types of issues. But then once we teachers are in classrooms or working remotely, are our grading policies sufficient in order that students have opportunities? Attendance policies. I've heard numerous educators really thinking about if a student does not attend a Zoom meeting, what does that mean? How are we ensuring that our attendance policies are fair for those students who maybe are having difficulty in getting on Zoom at a particular time? Special education policies, policies regarding students with disabilities. And we know that through a remote learning environment, there are lots of ways in which students with learning differences are being impacted. So thinking about equity when we're thinking about face-to-face again or remote, this is one of those areas that is of utmost importance. also, when we talk about leaving children behind and thinking about opportunities, you know, I tend to think that we don't have achievement gaps, we have opportunity gaps. And one of those opportunity areas is around the selection and identification of students who are considered to be gifted and talented, or in what we consider to be college tracks. These classes reinforce often race and class opportunity gaps. And so due to problems in these areas, this is a particular area that I think should be a focus of our work now more than ever as we go remote and have blended learning, to think about those policies. And then college preparation in general. What are we doing in this state of time around standardized tests, course scheduling, and so forth? So all in all, I see an anti-racist and equity-focused approach to reopening schools as first to determine which families and communities and students will be most affected by returning to school face-to-face or remotely, and then thinking about the policies that will really affect them and give them, those students and those communities and families, more opportunities or less opportunities. And I'll stop right there.
Thanks, Cheryl. So finally, we'll go to Joseph with a question. Joseph, in my introduction, I mentioned your background as the Chief Learning Officer for ISTE and your experience as an expert in educational technology. You know, there was broad consensus, I think, this spring that schools weren't ready for remote learning. How much of that not being ready was due to the digital divide? And how do you expect schools to bridge that divide this fall and this spring as we are moving to virtual and hybrid learning?
Yeah, thank you, Chris. It's a great question and something that I think is on everybody's mind. I just want to start with the experience I had earlier this week. I was talking to a second grade teacher in California, and she was administering a diagnostic test over the internet to a second grader. And in the middle of the test, the internet got cut off. So she texted the mother of the child and said, "Hey, we got cut off." And the mother texted back saying, "I lost internet." And the teacher texted back saying, "Great, let me know when it comes back on and we'll just get started again." And the parent texted back and said, "It's not coming back on. I've lost my job and I can no longer afford internet." And the teacher then went to investigate with the district what could be done. And the solution that was provided her was to have the child drive, I guess the child's parents drive and sit outside a school building and take the test in the car. And this was when the temperature was over 100 degrees Fahrenheit. Because I was in a position of privilege, I was able to intervene in that situation, and the child has since received a hotspot. But that sort of experience is happening all over the country right now. And we have had these divides for ever, really, you know, since the internet started becoming an essential part of school. They're just being exacerbated by this situation, and they're becoming visible. So in my first slide, I'm talking a little bit about the digital divide. There are 15 to 16 million students who lack adequate access to devices or to the internet to support learning from home. This need has been well known. We have heard that there's just not enough money to cross this gap, to fill in this deficit. But once it became the only way to learn, suddenly hundreds of millions of dollars appeared. So clearly, it wasn't that there wasn't enough money, it's that there wasn't enough will. And in many cases, we've seen investments of hundreds of millions of dollars into helping these students become connected to the internet. Unfortunately, it's not enough. We also have 9 million students lacking access to devices. Those disproportionately impact urban students, and rural students are also disproportionately impacted. And especially students in poverty are disproportionately impacted. And you'll find situations where the school may be asking, does this student have access to the internet at home? And the answer is yes, but they're sharing that access with 4 siblings and 1 device, which is not equitable access at all. Another new picture that we have is that there are actually hundreds of thousands of teachers who don't have access to the internet at home. This wasn't an issue when they were teaching at school, but it now becomes essential. In addition to the wires and the devices, which even though they're big gaps, they're relatively easy for us to think about how to solve them, we have a teacher capacity issue that's even greater and deeper, and will take even more of our resources and our time and our thoughtful investment to help teachers come up to speed on using technology effectively for teaching and learning. It's interesting to note that of the CARES dollars that have been provided for professional development, only 19% of districts plan to spend them on professional development. They're spending them on other priorities. So there's definitely an underinvestment in the training that teachers need to be prepared. On the next slide, I talked just a bit about some other inequities that are occurring. And unfortunately, all the groups that Cheryl listed as always having been in experiencing inequities are the same ones that are being negatively impacted. So we find students with special needs had a very, very difficult time accessing resources during the first part of COVID and are experiencing that again now. We know that low-income parents are having a very difficult time as well. And we also know that from the data we have from the Great Recession, that the reductions in school budgets that are going to result had a disproportionate negative impact on the long-term learning of Black and Latinx students. So we can anticipate a similar thing. If you look at some of the federal solutions, there's the possibility of ERate, which is a program that's currently used to wire schools with broadband. It could be repurposed to bring that connectivity to homes. There's a bill in Congress that would put $4 million into that fund, which could help. There's another Democrat-sponsored bill in the Senate that would add $175 billion to stabilize education and provide this PD. But there's a competing Republican bill that doesn't have any ERate funds in it and is less than half that amount. So in summary, we are seeing deep inequities exposed by this time that we're going through. They're persistent inequities and they're worse under these circumstances.
So Joseph, you know, your story in the introduction was very interesting. By the way, I know of at least one school district that has that knows its students and families lack broadband access, and their plan is to fill up school buses with students, drive them to school buildings using the Wi-Fi from the school buildings. So the students would essentially download their assignments while they're on the school bus, would not have to get off the school bus, which raises all sorts of questions for me around health concerns, of course, on the bus, among other things. You mentioned temperatures. I've never been on a school bus that was air conditioned in my life. Maybe they have that now. What, in terms of pointing out the digital divide, and I think this was relevant to one of the questions we've already gotten from the audience, what would be required from the federal government to actually bridge this divide completely? What you mentioned the ERate program, some other programs that have been proposed, but what programs and what amount of resources are we actually talking about, if there have been estimates, to actually bridge the divide and provide something approaching equal access for both educators and students, as you pointed out?
Yeah, so the estimate to close the gap for the 15 to 16 million students who we know are lacking that connectivity is the $4 billion that's being proposed to be put into the ERate Fund. And the reason that's a particularly useful vehicle is that states and districts already know how to access ERate money. There's an application process, they're very familiar with it, they've been using it for years. And this would essentially be putting, you know, a new checkbox on that existing process that says, now I need this for these students at home, rather than now I need this for these schools and classrooms. And so that $4 billion is estimated to cover that last gap for those students. What it does not cover, however, is the training that educators need to then make best use of that capability. And we're finding that that need is vast. And that's where you, unfortunately, find yourself in the tens of billions of dollars of additional funds to train those teachers, and just finding the right kind of training for them.
Thanks, Joseph. So Megan, in my initial question to you, I asked about the ethical variables that should be considered. One of our audience members already asked about sort of actual versus should, right, in response to that question. But to follow up a bit with that, beyond, as part of the sort of ethics of the decisions of reopening schools, not only what should be considered, but who should be considered. And could you speak a little bit to the ethics of involving parents and other stakeholders in the decisions around reopening schools?
So, it's a great question, and one that I know you and I had a discussion a little bit about this yesterday, that when we're talking in terms of a public health response to anything, we always talk about bringing stakeholders to the table. And honestly, in a lot of the discussions about school reopenings, you would think that from an education response, the stakeholders that should be brought to the table should not only include school district leaders and public health officials at this point in time, but teachers, parents, and students. And there's been variation with that, but unfortunately, probably on the side of not including parents and teachers and students enough in their perspective. It's important for several reasons. It's important first because they're the ones who are going to give you the perspective that Joseph just gave you, that they're trying to do a test from home and their internet dies and it's not coming back because they can't afford it. But it also helps. This is such a time of uncertainty. It's so hard for everybody to predict what schools are going to look like in October or January 1. And school districts have to deal with having to be flexible in new ways with limited resources. And we're asking a lot of parents and teachers to bring their kids and put trust in the school system. And in order to build that trust, there's got to be engagement in their input about what should be done, how it should be done, so they feel part of the process and they feel there's a transparency to that process.
Thanks, Megan. Cheryl, in your second slide there around sort of choice points and the decisions that we're making right now that are going to have disproportionate impacts, you mentioned mental health as well. And I think those of us with children at home that have been spending much more time with their families and away from their friends and away from school, we've seen an impact on students' mental health. And so could you talk a little bit about mental health and that issue of inequity and the role schools play and what we might see in terms of disproportionate impacts there?
Yeah, sure. I mean, I obviously, as a counselor, I feel like mental health is so important for, as we talk about readiness to learn. That is one aspect of being ready, is to be mentally healthy. And we know pre-COVID, before this, that students were often, as I talked about, traumatized children coming to school, not ready and not having the mental health services, families not having access to mental health services that's needed. And so now that's exacerbated by going remote. So we're looking at telecounseling, just like we talk about telehealth. We should be thinking about ways in which we can provide mental health to families and students, and students in particular, because one thing that school counselors are skilled and knowledgeable of is how to create relationships with students one-on-one or in group settings, and so that can be replicated in a remote setting as well. But the time has to be there. And so there has to be the nimbleness of the district or the schools to create that time. In my checklist, I said, I didn't go through all of those, but there was one that said classwork, avoiding busy work. Because often, if you think of a school day, the 8 hours that students are there, there's a lot of what I call fluff going on. And so now that we are, streamlining our learning experiences to a remote setting, some of that fluff can be taken away. Those worksheets that students are doing possibly just to get to the next period or to the next time that they're changing subjects, that time can be given to students to participate in what I call, healing sessions for students. I know in the higher ed setting, we have created spaces, not necessarily safe spaces, because the students say these aren't necessarily, I'm not feeling any more safe, but I have a chance to heal, to, reflect on what's happening in our country right now. Not only are we dealing with the shifts in education, but we're seeing on, as I said, we're seeing on camera killings of people who look like the relatives of some of our students, right? And so that's traumatizing. We also have the pending economic crisis. And so parents are, making, drastic changes to their family situation based on the economic situation. So students need to heal. They need to feel cared for. They need to feel loved. I call that, stealing from Bettina Love's work around finding joy, so embracing the pain, acknowledging the pain that students are going through, but also embracing the joy, the resilience of communities, the resilience of children and of families to get through. That's more important now than ever before. And that's a part of the mental health aspect of schooling, is for kids to feel safe, but also to feel appreciated, to feel loved, to feel that they have a place to go to talk if they need to. And so creating those spaces remotely is really important.
Yeah, that's really important. I think schools provide, good schools, safe schools provide that, and we need to figure out ways to provide that virtually, which can be very difficult. So Joseph, in your, you mentioned early on engaging with parents whose children might be being left behind as a result of the digital divide. What advice would you have for parents of children who feel like their children are at risk of being left behind as schools are moved to virtual learning?
Unfortunately, parents often have to advocate for themselves in these situations. It shouldn't be that way. We should have people inside of the system who are advocating for those parents. So, some things they can do is if their child has an IEP, they need to absolutely insist that IEP be honored and be adapted for current circumstances. And they need to be reaching out and requesting that, because that's required by law, and that can be a leverage point for a parent. They need to communicate with their teachers as much as they possibly can, make sure their teacher not only has their email address, but ideally also their text number, so that they can reach them. If they will ask a teacher, how can I help? And these are my needs. Sometimes the teacher is in a position to either provide some support or put them in contact with the right kind of support. They should absolutely be visiting the district website and looking through the offerings there. And they should be reaching out to school counselors and letting them know what their needs are. They should also be emailing their school board members and letting them know in what ways the school is or is not serving their needs and what needs they have. And they should be working through their PTA. So, the best advice I can give the parent is to be as loud and as clear as they possibly can be in letting the district know what their needs are. Some districts are offering technology training for parents, which can make a big difference in their ability to be impactful in their role as a caregiver. And so that's another thing they might request from the district is can we get some parent training sessions on the technology that my child will be using, so that I can be more helpful as well.
Thanks, Joseph. And I think parents as advocates really do need to be loud. I would also suggest that parents who feel like they're getting great service and great access for their children also speak up and tell their school board members and tell their communities. Schools need to hear when they're doing things right as well in this space. Megan, I mentioned earlier you're a faculty member in the Hopkins Consortium for School-Based Health Solutions. And I think one of the things that this pandemic has made us realize is the incredibly comprehensive role that schools play in children's lives. That includes delivering healthcare, asthma, glasses, sort of basic healthcare. When you look at, you mentioned the eSchool Plus recovery tracker, when you look at schools' plans, are they taking into consideration enough the role that schools play in providing healthcare? Or are we at risk of not meeting the healthcare needs, the basic healthcare needs of students?
I think we're at a real risk, and we're at a risk for a number of reasons. One is, school-based health seemed like a great idea a decade ago, in that this is where kids spent most of their day, and there were issues with connecting them with access to care in the community. So let's deliver everything in the school setting. Set aside that that's in kind of an incredible burden on schools to do that. It has helped improve access to care for millions of kids across the United States. With schools closed, we literally had, as of March 13th of this past spring, millions of students who were not able to access their routine care anymore. And, we had states suspend various screening requirements for the year, whether those were hearing or vision or things like that. And a lot of those are still up in the air as to how they will be implemented during the next school year. So you have all of these pre-existing school-based health services that will need to continue. We also have schools being put in the position of thinking about COVID and COVID, looking at kids who might have symptoms and what is their role in testing and what is their role in contact tracing. So their role has expanded. As Cheryl has highlighted, the mental health impact on students from COVID is profound. So we have this sort of expansion of all of these things that they're trying to do in terms of the public health response, addressing the mental health needs of our students and what they were already doing. And there are not enough resources or enough discussion at this point in time about how schools can and should support students from all of these different perspectives. And I worry because we know how the close relationship between health and education, and students who have poor health will suffer academically. So the discussion, I think, really needs to be more focused in that direction for school-based health services and what schools need to be able to do their job there.
Thanks. We've got about 17 minutes left or so. So I'll remind the audience, submit questions, upvote questions that you'd like us to make sure we ask. We've gotten to a couple already. I'll make sure we get to a few more. But as the questions continue to come in, I'll go back to Cheryl. What about the urban-rural divide here and the different needs and access issues that are involved in urban versus rural? How do you think those are being addressed by school plans, and what are your concerns there?
Well, urban and rural schools share a lot of the same concerns. That's surprising to some because we think of them as being totally polar opposites. That's not necessarily true. The density of poverty exists in both. Often in urban areas, you're talking about sheer numbers being so much greater, but then in rural areas, people are far apart. So the services have to be accessible. In many ways, when we think about schools in urban areas, although there's population density, and often we're finding people that are in need of resources, but the resources are more likely closer, right around the corner or at the school. You're talking about in a rural setting. I know from my school counseling background, school counselors in rural settings are going 50 miles to the next school, right? And so, just making it from one school to the next and being able to provide services, mental health services, continuing that conversation, there could be one counselor or therapist in a rural area that's spanning many, many miles, whereas in urban areas, you have a concentration of mental health providers within a certain sector of the city. So the poverty and the resources and the needs tend to be pretty much the same. It's the dissemination of the treatments, the interventions has to have a different design because of this distance issue. We know in urban settings that we find more diversity of people. And as I brought up, talking about issues of race and ethnicity, the issues of race are, I think in both urban or rural, suburban. I mean, we live in a very racialized society. It doesn't matter. I'm often asked, if it's all white, we don't have a race problem. That's not true. That's far from the truth. It doesn't matter the composition of the people. is that it's the history of oppression in our country that really has painted, you know, a mindset for our country and people and what we think of different sectors of people. So that is the same. How we address it, or our ability to bring in diverse people, so to bring in teachers and counselors of diverse backgrounds, becomes harder in a rural setting because of just the fact that you have less, there are less opportunities there than in urban settings possibly. So you might have more diversity to pull from as far as your workforce than in a rural setting. So I guess, you know, I could go on, but I think what is really important in this COVID state is that the resources for children, the needs of the children typically are the same, right? The mental health concerns are the same. It's the delivery of the treatment, the delivery of services that might be different. And so a different way of approaching intervention will be quite different, but the needs are quite the same. And the policies and all the other things I've talked about today are exactly the same. And I think, you know, rural teachers and educators will say they're dealing with opportunity gaps as well. Just in a different setting, just a different place. But surely the conversations around these important topics around equity are the same.
Thanks, Cheryl. Joseph, we got a question that's been upvoted a few times by our audience today from Jetta Queen. And the question is if this is the new normal that we're headed into now, what is being done nationally to ensure broadband access for all? You spoke to this a little bit earlier, but I would also add to that question, is there a state or a region or a locality that you see as being a leader in this space?
Yeah, so definitely action on the national level would be welcome. And executive action is possible, though there hasn't been an appetite for that. But certainly Congress could act, as we discussed earlier. So that's one possibility. But states actually have a huge amount of discretion here to make an impact. So a few that come to mind, you know, Nevada has taken a really innovative approach. They've recruited what they call digital engineers, and these are people in the school systems from around the state who volunteered to take on an additional assignment, and then they work collectively with those digital engineers to address the specific needs of that state. So where they have a broadband access problem, all these digital engineers brainstorm together and look at resources and share solutions that they've used and work with that locality to try and solve it. Where they have an expertise deficit, they work together to create the materials that would be useful for that kind of system to use to overcome that expertise deficit. And so I think that's a really interesting and innovative approach, is to take the resources you have and redeploy them. Tennessee has built an online learning hub, and you can actually, you know, go there and get some of the training and some of the support and even some of the content that you may not have available to you locally. And so by pooling their state resources, they're able to make that difference. And then Virginia has a virtual Virginia platform that supports their educators as well. And so, you know, where as usual, if the federal government is not choosing to intervene, the states have a lot of possibilities and various ways they can engage to address some of those gaps themselves.
Thanks, Joseph. We have a question from Lisa to Megan, asking whether around the ethics of schools providing medical services to students. And I think the concern raised by Lisa is the attempting or the delivery of medical services by schools making the educational services process too complex? What's the ethics of delivering medicine at schools?
So it's a great question, and I think one that there are a number of tensions behind. You know, one of the things I wanted to mention earlier that this is now a good opportunity to mention it is as schools closed and students were left without what had become a home of health care resources, there really has been a call to action in the local communities to make sure that children who were not previously accessing care in the communities, and we've relied on schools to be that home, to step up and be part of the solution. And that needs to happen more and more. Schools cannot be relied on to be a therapeutic home for students' physical health services. It's unsustainable, but they are a good connection to care. And they are a place that kids are, usually for 8 hours of the school day. And these are, sometimes it's external providers coming in, running school-based health centers or other school-based health programs rather than the schools themselves overseeing healthcare. But again, there needs to be that connection. Schools can't be left alone. We've asked schools to assume so many responsibilities in the well-being of children, and we haven't necessarily given them all the resources to be able to do that before COVID, and they certainly don't have the resources to do it during COVID.
Thanks, Megan. There's the ethics of providing the services, of course, and then there's ethics of not providing the services, right? It goes both ways. A number of people have upvoted this question from Megan, and it's aimed at Cheryl. I'll read it. It's a longer one here. In working with schools and districts around reopening activities, we are finding that many do not know evidence-based engagement strategies to engender family, students, and community involvement in school decision-making. Do you have any recommendations for finding or coaching others in these engagement strategies?
So do you want me or Megan? Me?
I mean, that was for you, Cheryl.
Okay.
You want me to read it again or you got it?
Yeah, can you read that one more time?
Sure. So the question is, this person is working with schools and districts, and she's been finding that many do not know evidence-based engagement strategies to connect and engender family, students, and community involvement into school decision-making. And she's asking you, do you have any recommendations for finding or coaching others in engagement strategies such as this?
That's a good question. And I agree with the audience member that, that engagement strategies now are more important than ever before, right? And engaging groups that have been historically, I would say, silent or erased from these kinds of conversations, the empowerment of communities to make their own decisions. So asking parents to engage in a process that they haven't necessarily, particularly in many communities, Black and Brown communities where there's a lack of trust. And so relationship building is really important. I would say that, this is a time to find community organizations that are based in the community, to be a part of those conversations, and that kind of training around community engagement to bring those organizations in with parents. And there's several, if it's a Baltimore-based question, there are several organizations in Baltimore, community-based, that I think would be great partners. I also think universities, and Chris, as deans of schools of education, I think we're underutilized often in these types of exercises of working with communities. I think I believe it's time for our faculty and our staff to become more engaged with our community schools, and universities are a part of the community. We are often anchored in our communities and should be an active voice in these conversations. So I would say to the audience member to, and it could be a conversation that I could have offline, but there are many community-based organizations that do this kind of work with parents. And I think coming together with university leaders, school-based leaders, and creating a collective in which you can talk about these kinds of issues. I also want to make a shout out to school nurses. I saw that in our chat, and I can't believe I forgot that, because school nurses, just like school counselors, are so important to this work. And we need to see more school nurses. We need to hire more qualified school nurses to work in schools if we are truly going to reopen in a way that's safe for children. Yeah,
we've unfortunately made the decision as a nation to replace school nurses and school counselors with police officers. And I think we're going to find out that that's not going to do us much good right now.
It doesn't help with equity, that's for sure.
So we've just got a couple of minutes left. Our series is focused on how COVID will change schools both during and after the pandemic. So I'll just give the finalists really, really quick follow-ups here. Last words on the subject. And I'll start with you, Megan. What do you see as the lasting consequences for the pandemic with regard to with respect to the role of schools in providing equal access to high quality learning environments?
Well, I'm going to give you my optimistic perspective is that, you know, never before has national attention been so focused on these underlying inequities that have been exacerbated. So we have an opportunity now. We have a voice, people are listening. This is the time to have this conversation and move the equity issues forward to narrow these gaps. There are innovative possibilities now. We're using technologies in ways now that we've never used before. And thinking about how that can help bring us forward, I think will be critical to the conversation.
Thanks, Megan. That is optimistic. Joseph, final words from you. What do you think is going to be the lasting consequences of all of this?
Very, very similar. Technology is an accelerator. It can accelerate good practices or bad practices. And on the positive side, we have an opportunity to rethink what education is. Maybe we can be a little less focused on seat time, more focused on mastery of the material. Maybe we can use technology to increase differentiation so that each child is getting the content that they need at the level that they need it. And one of the silver linings that I've heard many educators talk about is they've had more contact and more integration with the caregivers of the children than they've ever had before, because it happens to be necessary. But that's not something we have to leave behind. We can stay in contact with the children's caregivers, and we can build those relationships and bring them in as partners and open that up to the community for mentors and others to also be involved and support education. You know, in a way, we can use this time to throw up walls or to take them down, and I hope that we'll choose to take them down.
Yeah, we could do a whole webinar on sort of what we've learned from this that can actually improve schools, right? What we can come out on the other side of. Cheryl, last word, lasting effects. What do you think?
I'm feeling positive and optimistic too. I'm thinking that, you know, in my experience, in my career in education, I've never seen a time like this before. And so I think it presents an opportunity for us to be creative and innovative and, you know, to do all of those, you know, implement a lot of the strategies that we've talked about for years, but didn't have enough institutional will to actually carry them out. And so I'm hoping that now we have this opportunity to actually implement some of those creative ideas using technology, giving teachers more time for professional development, and creating spaces for students so that they can learn. I'm also optimistic that we're also talking about race and education, racism and education like we've never done before. The fact that I can say anti-racism here and not feel that I'm going to get a lot of pushback for saying it and talking about anti-racism is a step forward. I think we have to, you know, it's time for us to reckon with our history in this country and how racism has played out in education, has been perpetuated in educational settings that has caused the inequities that we're talking about. The same is true in health fields. So education and health and looking at you know, how these are inextricably connected, right? That I think Megan talked about earlier is so important. And we're getting a chance to actually have fruitful, robust conversations about that and creating about those connections and creating strategies in which we're bringing health professionals and educators together. I'm enthusiastic and thrilled that we're having those conversations. So we just have to make the best of it. We have this opportunity, we have to make the best of it. And surely we cannot go back to the same inequitable place where we were pre-COVID. That's what I'm trying to avoid.
Yeah, this is a moment, the intersection of the pandemic, the politics of our nation, and the violent products of systemic racism that we're seeing playing out in front of us live, unfortunately, in some cases. If this doesn't cause us to rethink a lot of the things we're doing in our most important institutions and schools being front and center, I don't know what will, right? So
And Chris, I would say even not rethink, but disrupt, change, right? Change it, and not go back. Yeah.
Well, we're coming up on the hour, and I want to start out by thanking each of our panelists for joining us this afternoon for what I thought was a very insightful and robust discussion on the topic of who's being left behind. I also want to thank the audience members who submitted questions or upvoted questions for participating. And we tried to get to as many questions as we could. If we didn't get to yours, I apologize, but there's always next week and our webinar next week to ask a question and to upvote another question. So I encourage you to look for that opportunity. We are going to continue here at the School of Education to examine how American education is being transformed by this pandemic. Our third in our webinar series on impossible or imperative will be offered on September 1st, next Tuesday at 1 p.m. And we're going to tackle the question of more than buildings as we look at what COVID can teach us about the need to reform educational policy for today's schools. So please do look for an opportunity to register for that upcoming session on September 1st at 1 p.m. We've got another great panel. Our guests will include Bob Balfance, who is a professor here at the School of Education and director of the Everyone Graduates Center. Dr. Rob Yeagers, Vice President of Research at Castle, and Monica Quinchola, Senior Director of Strategic Initiatives and Partnerships at America's Promise Alliance. So I do invite you back next Tuesday at 1 p.m. for our next in this series. Thank you again to our panelists. Thank you for the audience, and enjoy the rest of your afternoon.